You know, when we think about major accidents, our minds usually jump to broken bones, maybe head injuries. But what about the damage we can't see? Today, we're diving into something that's critical, but often overlooked: trauma to the genitourinary tract.
So here's our game plan. We're going to start with the basics. What even is GU trauma? Then we'll zoom in on the two organs that get hit the most, the kidney and the ureter. After that, we'll get into how doctors figure out what's actually wrong, and finally, how they put it all back together.
And really, that is the big question, isn't it? A high-speed crash or even just a really bad fall, all that force has to go somewhere. And it turns out our body's internal plumbing system is surprisingly vulnerable. Okay, so let's get our bearings. The genitourinary system, we'll just call it the GU system, is basically our body's filtration and drainage network. It kicks off with the kidneys, they're the filters. That connects to the ureters, which are the pipes that carry urine down to the bladder for storage. And finally, it all exits through the urethra. That's the system we're exploring today.
And get this isn't some rare one-in-a-million thing. About 10% of all major trauma cases involve an injury to the system. Think about that. For every 10 people rushed into the ER after a serious accident, one of them has this kind of internal injury. What's really interesting here is the context. Most of these injuries come from blunt force. We're talking car crashes, bad falls, way more often than from penetrating wounds like a stabbing. And here's the kicker. A GU injury almost never comes to the party alone. It's usually a +1 with other really serious injuries elsewhere in the body.
All right, first stop on our tour, the kidney. This is the big one. It is the most commonly injured organ in the entire GU tract. And as you'll see, there's a very good reason for that.
So your kidneys are kind of tucked away in your back, which offers them some protection. But, and this is absolutely key, they are incredibly vascular. The best way to picture them is like two big sponges just soaked with blood. So while they're protected by ribs and muscle, a really forceful impact can cause major bleeding.
This breaks it down perfectly. There are basically three main ways a kidney gets hurt. First, you have blunt trauma, like a direct hit. Then there's penetrating trauma from something like a knife. And then there's this third one, a deceleration injury. Imagine a car crashing. Your body stops, but your organs kind of keep going for a split second. That force can literally tear the kidney away from its blood supply. It's pretty wild.
To make sense of the damage, doctors use a grading system. Think of it like a scale. A grade 1 is just a contusion, basically a bruise. As you climb the scale, the cuts get deeper until you hit grade 4, which is a shattered kidney. And then you have the most severe, grade 5. That's when the main artery or vein is torn, a true life-threatening emergency.
So how does your body tell you something's wrong with the kidney? Well, the #1 red flag is hematuria. That's blood in the urine. That's often paired with a deep ache in your side or flank. And in those really bad cases, like that grade 5 injury, the patient will show signs of shock from all the internal bleeding.
Now here's something that might surprise you. Most of these kidney injuries, over 90% of them, don't actually need surgery. For the less severe ones, all it takes is what's called conservative management, pretty much bed rest and observation. But if a patient is unstable, surgery is the only way to go. And there's also this really cool technique called angioembolization, where a specialist can actually go in and plug a bleeding vessel without a big operation.
Okay, let's move down the line to the ureter. This is the delicate tube connecting the kidney to the bladder. And injuries here, well, they're a completely different story.
Yeah, unlike the kidney, injuries to the ureters are pretty rare, but that's exactly what makes them so dangerous. They're sneaky. They often get missed during the first look at a trauma patient, and the consequences of missing one can be severe.
To really understand ureter injuries, you need to know this term, iatrogenic. It sounds fancy, but it just means an injury that was accidentally caused by medical treatment. And this, believe it or not, is the #1 cause of damage to the ureter.
This slide just makes it crystal clear. Look at the most common cause, pelvic surgery. The ureter can get accidentally clipped, tied, or even burned during a complex procedure. Penetrating trauma is next, but notice what's way down the list. Blunt trauma. The main reason kidneys get hurt is almost never the cause here.
The alarm bells for a ureter injury are way more subtle, and they often show up late. A patient might get a fever, some flank pain, maybe they're not producing as much urine. But the real telltale sign is a urinoma. That's a collection of leaked urine inside the body, which, as you can imagine, can lead to a really bad infection.
So with these very different injury patterns and symptoms, how do doctors actually see the damage? It really comes down to using the right tool for the right job.
And this side-by-side is perfect. For a kidney injury, the gold standard is a CT scan with contrast dye. The dye lights up the kidney and immediately shows any bleeding or tears. But for a tiny little tube like the ureter, you need a more specialized scan, like a CT urography, or even a retrograde peelogram, where they inject dye up the ureter to find the exact location of a lesion.
Now that we've diagnosed the injury, let's compare how they're treated, because the philosophies behind them could not be more different.
And this just nails the core difference. Remember we said most kidney trauma is managed conservatively, with a wait-and-see approach? Well, for the ureter, it is the exact opposite. A damaged ureter will not heal on its own. It almost always requires a surgeon to go in and actively repair it.
And the repairs themselves are pretty complex. Depending on the damage, a surgeon might just stitch the two ends back together, or they might place a little stent inside to act as a scaffold while it heals. And for really bad damage, they might have to do a complete re-implantation, basically creating a whole new connection to the bladder.
So we focused on the upper tract, but what about the lower part of the system? Bladder and urethral injuries are actually super common with pelvic fractures. The key signs here are pain just above the pubic bone, not being able to urinate at all, and the classic sign, blood right at the tip of the urethra.
And this really is the crucial takeaway for all of these injuries. Early recognition prevents complications. Doesn't matter if it's a kidney bleeding out or a ureter leaking, catching these things quickly is the single most important factor for a good outcome. Period. And this brings us to a final thought. It's kind of fascinating, right? You have the wait-and-see approach that lets a kidney heal itself versus the intricate surgery needed to fix a delicate tube. GU trauma shows this incredible dance between the body's own resilience and medical intervention. It really makes you think, what does it truly take to give our amazing repair systems the best possible chance to work their magic?